How to treat your itchy private part. Mostly for the female, this video is intended for the female. So there are a couple of things. First of all, you need to actually find out what is causing your private part to itch. So in that, we say you identify the cause. You identify the cause. So what are the common causes? We say the common causes of itching in your private part include, among others, fungal infection. Commonly, there is what we call candidiasis. But how do I know, or how do you know that you have candidiasis? So you need to go and visit your doctor or any hospital near your residence, and then they do a couple of tests, what we say calling identification. Among the tests we can do, we can actually get urine, do what we call a urinalysis, and then in that we shall be able to identify. So we need a urine sample, first of all, then carry out what we call a urinalysis. And in this, we are able to detect things like yeast cells. So when we detect yeast cells, now this is because there are various types. You can have a valvular candidiasis. This is on your actually vulva. Or you can have a valvular vaginal candidiasis. And now what happens is that still you get the itching. For the valvular candidiasis, the itching will be on the vulva. Then for vulvar-vaginal candidiasis, it will be on the vulva outside or in the labia majora and minora, but also inside your canal or your private part. And then we are saying the only thing you need to do is to go to the hospital, visit your doctor. They will get a sample, what we're calling the urine, carry out a test known as urinalysis. They will analyze the urine, and what they will see to confirm that you have a candidiasis is what we call the yeast cells. So when we confirm that what is causing your itching is a fungal infection, then automatically the treatment will be simple. So the treatment will be, what are the common treatments? Of course, when you have candidiasis, the treatment will be targeting the fungal infection. So commonly, it's not a good practice that you need to go to over-the-counter medication or to go to a pharmacy and just say, you know what, doc, or the pharmacist or the dispenser in that place, that just, I have itching in my private part. Give me something, when they have not done what we've explained already here. So it's better you first do this. So when we confirm, then the doctor will write for you the prescription. Among the common things we used to treat, I think you've heard of candidum cream. This is a cream, and this is commonly used to treat the valvular candidiasis because it is external. We don't want you to actually put your fingers inside. So if we confirm you have only this, then this is enough for you. So you apply after your bath, you dry the private part, then just the way you apply your jelly on your body after showering, the same way you apply the candidum cream. Or we also have what we call trimazole cream. It also works very well actually. So you can also apply it and it will treat still the same. Or for our friends who actually don't like creams, you can use what we call vaginal pessaries. And commonly in the market, before, we used to have what we call nystatin. It's still in the market. However, currently we have the gynazole pessaries. I'm teaching you this not to go and ask at the pharmacy, but just to know that the variety of things that can be done for you in case the diagnosis is confirmed. But I also want to emphasize that for this option number 2, in terms of pessaries, these are things actually we give you and you put inside your private part. And these ones we said you just apply topically outside. These ones you insert inside. But it differs. For this, we'll treat this. Valvular candidiasis, If the doctor tells you have vulvar candidiasis, then this is okay. However, if we say you have vaginal candidiasis or vaginal candidiasis, then this is better. Or in some actual incidences, we can do a combination of the two. Then at times, in terms of identifying the cause, we can go an extra mile and do what we call culture and sensitivity. This is where the sample taken, some of it is used to do a urinalysis or a wet prep. However, they will go ahead to pick some of the deposits, and then these are actually taken to the microbiology lab for culture and sensitivity. Then we wait for some time and see what grows. Because at times, it's not only the fungal that actually will cause the problem, but at times we also have actual organisms like the bacteria. And the common ones, the Trichomonas vaginalis, the gonococcal infection, or the commonly known as gonorrhea, gonococcal. Then we have actually chlamydia. Then we're talking about T. vaginalis. Now, if you did a gram stain, you'll be able to identify this. Or if you did the culture and sensitivity, you'll have a growth, but for the gonococcal screening. And in here I was saying, gonorrhea is very sensitive. So really what happens is that usually you go to the microbiology lab and the sample is picked there and then the gram stain is done, and then the culture and sensitivity is done. And usually this takes 3 days, that's 72 hours. For you to get the results, be sure what is causing the problem. Then the chlamydia, you can also do the same, get the sample HVS, though this one is actually gonococcal, it's so aggressive compared to chlamydia trachomatis, but all of them we can be able to actually do the investigations and find out specifically what is causing your itching in the private part. All that said, we can also have things like irritants. Irritants can also give you itching in your private parts. So what happens is that usually people do abnormal habits or things which are not healthy. For example, dodging. If you practice dodging for a long time, you can end up with itching. If you use irritant soaps or soaps with or things that have a lot of scent, mostly soap can also give you itching. And then if you have some kind of allergy, for example, if from your childhood you've been having allergy, skin allergy, and then you are allergic to some substances, including the chemicals that they use to make some of the products you use or to apply down there, will also end up giving you itching in your private part. So for the things that you use, if you identify a product that makes you itchy, either the whole body or just in your private part, the advice would be you stop actually using them. And then in terms of general care, we are like, it's better to use cotton underwear. They are good because they actually allow your private part to breathe, if I can use that word. And then avoid tight clothing. They also actually help if you use not so tight. They shouldn't, like usually nowadays ladies, you love a lot of legging, things which are so tight. Those ones actually allow organisms to grow. These organisms can end up, for example, causing the various infections we talked about that will end up giving you the itching. Then if all this or all that has not helped, kindly visit your doctor and then tell them how you feel. They will assess you and then find out what the problem is, and they will give you a proper treatment. Just know that whatever is causing your private part to itch can be treated or can be managed either using medication or just changing lifestyle. Thank you very much. Once again, I remain Dr. Siraj, the Women's Health Specialist. Once again, if this is your first time, we appeal that, or I request that you subscribe, you follow for updates that happens weekly.